So do you go by your first name? You go by
Palak Pandya.
Palak Pandya. That's the whole thing. Palak Pandya.
Yes.
Well, you've been really kind to me over this last year that I've known you. I'm telling you that. It's been quite an experience. Now look at my smile. It was an unexpected thing for me to go through the process of getting here and then learning what it took, because my particular program with dental implants didn't quite work out the way I wanted. And yet at the same time, it turned out to be as good as it could have been in any situation. What do you think you could have done that would have helped to make it better for someone who's coming for some kind of dental work? We're trying to get an idea of if someone's living in the United States or even living in other European, any country in the world who wants to come here for some kind of work. What should they think about in advance before they come? What kind of problems would they encounter?
For the implants, basically we need to first check up with the medical conditions of the patients. If the patients are thoroughly medically fine, then we can go for an implant. And once if we decide that patient is completely fine, if he is not suffering from hypertension, any other renal problems or blood pressure, and any other bleeding dyscrasias, then we can think of implants. And then after having the option of an implant, we can definitely go for certain reports like in X-rays, like OPG, that is oral ventrogram, and the CT scan, that is a dental scan specifically for a maxilla and the mandible, by which we can just know the width and the height of the bone and the amount of a bone which is available with us, so we can predict that definitely implant is going to work for us.
So let me see if I can understand what you were saying, because some of your words were a bit technical.
Yeah.
Basically, as I understand it, what you're saying is that someone who is considering implants has to think about how long ago the tooth loss occurred, because when you lose some of your teeth, the bone goes smaller over time. And as a result of that, that may impact whether you can have implants or not. And I know this because that was my difficulty, is my teeth, as a child, I had problems with them, and that caused the bone.
You lost it more over 20-25 years ago.
40 years ago, actually, but yes. So that caused it to be a real problem for me in terms of getting those implants. And you also mentioned something about blood. As I understand what you mean, you're talking about the clotting time
and the bleeding time.
And the bleeding time, because that impacts whether or not they would be eligible for such procedures.
Yes. Here usually it will cost you, if one implant you want to go for in India, it will cost you $1,200 to $1,500 per implant it may cost you. And in that we include the procedure from the beginning to the end of it. When we put in prosthesis, first when we put an implant and then we put in prosthesis, we include everything in $1,500 usually.
So you're saying that you put the crown on top of the implant, then that's what they want to hear, that you get the complete thing. If they need multiple implants, will you give them a better price because they need more at one time?
Definitely yes. Then we give them in package. The complete package will be provided seeing them. Another one more thing which I would like to add for an implant, that anybody who comes down here for an implant, they should be kept in mind. It should be kept in mind that it may not be a single visit. For them, it may be 2 visits or it may be 3 visits. Most probably in 95% of the cases, it is 2 visits. Once when we put an implant, afterwards they may need to wait that implant should get integrated or get properly attached to the bone. And then after another 6 months or 8 months, they need a second trip to put a crown on them. In a certain cases, in a maximum of cases, we may have to follow in 2 visits. In certain cases where we get a very good primary stability, and when we are fixing our implants in the first time, when we see that the implant is setting up a hard rock inside, that time we can think of a single setting implant. Otherwise, implants usually what we follow is double setting implants. That should be kept in mind.
Yes, that is quite important. There's only a few times when they can actually put in an immediate load implant.
Yes, the immediate load implants at very certain timings, and particularly a population about 40 to 45 years above.
So if you're in that age bracket, there might be a possibility if you had to make an extraction, or if the bone was correct, then even without an extraction, you could put an immediate load implant. Now I've seen a couple of specials on the television in the U.S. about people having immediate load implants. But that's only under the absolute best conditions for them.
Yes, definitely, yes, absolutely best conditions, and for that you need very certain criteria. And then you need more of the follow-ups will be there with the dentist if you go for an immediate root implant. Even at that time also you may need to go after three months, you may need to go for a change of your crowns once again in case of an immediate root implant.
So even if they use an immediate load implant, doesn't mean you still might not have to come back for a visit, whether it's here or someplace else.
Not at all, not at all.
But the cost, even if the cost of a round trip, is not going to be anywhere near what you would have to pay for several of those implants in the U.S.
Yes.
Because of that same situation.
Yes, definitely. Yes, definitely. If they want to go for a bridge or something, and if the work is like, if they want to go for a full mouth bridge, and particularly we give them a Procera crowns. With those Procera crowns.
And you're saying porcelain?
Yeah. No, the porcelain is different, and the Procera is different. Then it'll be roundabout for them, for each tooth, around about $200 for them.
So let me get clear about that, because my experience was in the U.S. the price per crown is around $1,000.
Yes, so it'll be round about here.
$200.
Yes, it'll be round about $200 to in between $200 to $500, but it'll be half of it.
Yeah, half of it.
Yes.
Well, you know, when I went to that Mexican clinic, and he charged me $450 for each
Yes.
of those crowns, beautiful porcelain crowns,
Yes.
and I had to have them removed here. I watched $10,000 come out of my mouth, and it had only been in there about 18 months, and I almost cried looking at it. I could have came to India, had the work done, gone back, and saved half my money. And so, for me, that was a great big bell that said, hey,
Yes.
try not to let this happen to anyone else if you can, because the difficulties that you have with language are not anywhere near what they would be in Mexico, because they don't speak very much English. You speak far more English than they did, as far as understanding goes, because you want to know what the procedures are going to be, how long they're going to take, what the difficulties are going to be, and that sort of thing.
Another thing, positive part of us is we definitely understands the patient's time which is available to us. We try to maintain those time limits as well also, and we make patients very much aware about it, that what you should, how much time you should be needed it, and what it should be expected for us, and how it's going to be.
So, if someone has only 2 weeks available to them, you would be able to determine what kind of work could take place during that 2-week period?
Yes, definitely. If we have through the telemedicine, if we have all his reports before available with us,
so
that we no need to spend the time in investigation. Certain investigations, as I told you, the OPG and the X-rays which are needed, and the histories, all dental histories if it is needed, if it is given to us, we can finish it up then.
So you mentioned telemedicine. This
Yes.
is a new thing for the world, I think, with the advent of the internet. So it's possible for someone in the U.S. to be able to set a time
Directly talk to me.
and directly talk to you.
We can have an audiovisual conference.
Audio-visual conference.
Yes.
And you have the facilities here at this hospital downstairs that will allow that.
Definitely, yes.
And you would be able to be there at a time, because we're opposite almost. I think there's 10 and a half hours difference between here and the U.S. So that would mean that you would have to be up in the middle of the night, or someone would have to find the right time.
Yes, we can find out the right time for that, definitely.
Okay, so that could all be coordinated then.
Yes.
Well, this, for my part, seems to be the thing that I wish I could have done. That would have saved me some time and no doubt some money.
Yeah.
But at the same time, I can recognize how, in the future, anyone wanting to come here could benefit from my difficulties and the situation that you had to encounter. I'm smiling because I have a very beautiful smile, I must tell you. And it took a lot of work on the doctor's part to make that. One of the main things I noticed is that in the U.S., I've had a couple of partials put in, and the dentist would take about 5 to 10 minutes to adjust my bite. Here, they took 5 hours altogether to make sure my bite was absolutely perfect. And I've never ever encountered that before. They explained to me that if you don't do it right, then your mouth has to adjust to the teeth and not the teeth being adjusted around the mouth, and that's a big important point. So, for that I'm grateful. Dr. Kaftanja, thank you so much.
Okay, thank you.